Hello everyone, my name is Harshal and today I'll be presenting my project on medical insurance data analysis. In this project, I've explored key factors influencing medical costs such as smoking status, BMI, and region using an interactive Excel dashboard. The goal of this analysis is to help insurance companies, healthcare providers, and individuals better understand how various factors impact medical expenses and to provide data-driven recommendation for improving healthcare cost management. The primary objectives of these projects are understanding key factors affecting medical costs, identifying how BMI, smoking, and region impact medical expenses, developing a predictive approach, analyzing correlation to help forecast potential medical costs, providing insight for stakeholders, offering valuable data-driven recommendation for insurance companies, healthcare providers, and individuals. Now, let's move on to the analysis and key findings. So, the first questions we just asked is calculate the average, median, and standard deviation of medical charges, BMI, and age across the entire dataset. So, for that, what we've done here is we created this table where we have average, median, and standard deviations of medical charges, BMIs, and age. To calculate the average, you, you use the simple average function. To calculate the median, again, we use the median function and standard deviation again, same for that. And here we have this table where we have the average charges, average BMI, average age, median, and standard deviation of all the factors we enrolled in. So here you can see we calculate the average, median, and standard deviation of medical charges, BMI, and age across the entire dataset. So on to the next question, which is to compare the average medical charges and BMI between male and female beneficiaries. Which gender has high average cost and BMI? For that, what we've done here, we calculated again, we calculate the average charges and BMI, and particularly using the gender. So here you can see we calculate the average using the average function. We calculate the average of BMI, average of medical charges, only for the male beneficiaries, and here we calculate the average medical cost, particularly for the female beneficiaries. Same here for the BMIs as well. And from that, what we've got is the average medical charges differ by gender. Males have a significantly higher average medical charge compared to females. This suggests that gender plays a role in determining the medical cost. BMI is slightly higher for males. The average BMI for male is around 30.94, is slightly higher than the average BMI for females. While the difference isn't drastic, it indicates a tendency for males to have a higher body mass index in this dataset. On to the next question, which is to analyze how smoking status influences medical cost. Calculate the average cost for smoker versus non-smoker. For that, again, here we calculated the average charges for smokers and non-smokers. For that, what we have done, again, using the averages function, we calculate the average medical cost where the smoking is compared in yes or no. So the average cost for a smoker is around 32,060, and for a non-smoker it is around 8,434. From that we got this insights. Smoking significantly increased medical cost. The average medical cost for smoker is 32,050, is dramatically higher than the average medical cost for non-smoker. Magnitude of cost difference. The average medical cost for smoker is nearly 4 times higher than that of non-smoker. This highlights that substantial financial impact of smoking on healthcare expenses. Here in the dashboard, we created this column chart where we compare the average medical cost for smokers and non-smokers. On to the next one, the fourth question, which is to evaluate the relationship between the number of children, dependents, and medical charges. Do beneficiaries with more dependents incur higher medical costs? So for the fourth one, we created this table where we compare the average medical charges with the number of children they had. For that, what we have done is again using the average function, we calculate the average charges by the dependents or the children they have, and we compare the medical cost with using the correlation. We compare using the correlation function. We compare these medical charges, and from that we got if the correlation number is close to one, that means more children and higher charges. If the correlation number is close to zero, no linear relation, and if it's close to -1, more children and lower charges. Here we compare the here we using the chart we have compared the prices and the correlation line, and from that we have these findings. So having more children doesn't necessarily mean higher medical charges. In fact, there's a very slight trend suggesting the opposite, but the relationship is weak. The number of children alone doesn't explain much about why medical charges vary. Other factors are likely more important. The next question is to determine which US region has the highest average medical cost and BMI. Create a pivot table and chart that summarize the data by region. So for that, what we've done is we've created this pivot table where we compare the where we list. We created this pivot table where we have region in the rows and average of medical charges and average of BMI into values, and created this column chart where we compare the average BMI and average charges per US region. So the region with the highest average cost is Southeast, and the region with the highest BMI is Southwest. Here we can see we compare all the average charges and BMIs using this pivot table, and in the dashboard also. Here it is the average cost and BMI by region, and from that we find some key findings. People in the Southeast generally have higher medical bills and higher BMIs compared to other regions. There's a tendency for region with higher average BMI to also have higher average medical costs. On to the next question, which is to create a histogram to visualize the distribution of medical charges, identify the most common cost bracket. For that, what we've done is we've created this bin where we edited the bin values from 5,000 to 70,000 to compare the distribution. And again, here we have created this frequency where we have the medical cost and number of people having been in that bracket. And we go to the data tab, then the data analysis tab, and here we find the histogram, and then we click OK, and then we have this frequency and mean values, and created this histogram to compare the distribution of medical charges across the entire data set. So onto the so from that, what we have is some key insights. Most people have relatively low medical expenses. A small number of people have very high medical expenses, pulling the average up. There are not many people with extremely high medical costs in this data set. On to the next one. Classify beneficiaries into BMI categories as underweight, normal, overweight, and obese. Count how many beneficiaries fall into each category. So for that, what we've done is we created this BMI category chart where we have these four options: underweight, normal, overweight, and obese. Then we counted the BMI. BMI category, weight category by using the county function from the BMI category column. And for that, what we have done is we are using the if function. We have categorized the BMI values into BMI categories: overweight, obese, normal, and underweight. And we compare the values and count using the pie chart. So from that, what we have is the most people in this data set are either overweight or obese. A moderate number of people are in normal weight range. Very few people are underweight. And from that, we have some suggestions, some implications. Public health concern. The large number of individuals in the overweight and obese category suggest a potential public health concern related to obesity and its associated to health risk. Impact on medical cost. Given the link between the BMI and medical costs, this distribution of BMI categories likely contributes to higher overall medical expenses. On to the next question, which is to use a scatter plot to analyze the correlation between medical BMI and medical charges. Add a trend line to the scatter plot to assess the relationship. For that, we compare the correlation between the BMI and the medical charges, average medical charges, using the correlate function. And to summarize it within the chart, using the BMI and charges column, we compare the values and we have this trend line suggesting the correlation value between the BMI and overall medical charges, average medical charges. And we created this scatter plot. And from that, we have some key findings like there's a slight tendency for people with higher BMIs to have higher medical charges, but the relationship is weak. BMI alone doesn't explain much about why medical charges vary. Other factors are likely more important. On to the next question now, which is investigate the interaction effect between smoking and region on medical charges. Which region has the highest cost for smokers? For that, again using the pivot table, we created this pivot table where we have smokers in column, region in rows, and average charges in values, and we compare the average medical cost for smokers and non-smokers according to the region, and from that we created this column chart where we compare the average charges by region and smokers, and here we can select the regions as well. From that, what we have, we find some key insights like smoking makes a huge difference in medical costs no matter where you live. People in the southeast tend to have higher medical costs, especially if they smoke. So, some key implications we have suggested: targeted interventions. The findings suggest that the need for targeted intervention and prevention programs to address the specific needs of different regions and populations. Insurance pricing. Insurance companies may consider these regional and smoking-related differences when setting premises. On to the next question, which is to develop a comprehensive dashboard that provides stakeholders with insight into medical costs, including filter for gender, smoking status, region, and BMI categories. And here you can see we have created this dashboard where we have the average medical cost by smokers and the correlation between the BMI and average medical charges. Then we have the BMI category count. We have the average charges by region and smokers, average cost and BMI by region. Then we have the average charges by number of children, number of beneficiaries, the distribution of medical charges, and we have some filters here: smoker, region, and BMI categories and sex. So from the data analysis we've done, we have some recommendations. So the recommendations are for healthcare providers: target smoking cessations program. Given the strong correlation between smoking and increased medical cost, healthcare providers should prioritize smoking cessations program and interventions focus on weight management. The high prevalence of overweight and obese individuals suggests a need for increased focus on weight management and healthy lifestyle promotion. Address regional disparities. The Southeast region consistently exhibits high medical cost and BMI. Healthcare providers in this region should investigate potential contributing factor and develop targeted interventions. For insurance companies, consider smoking status in premises. Insurance companies may consider adjusting the premiums based on smoking status, given its significant impact on medical costs. Incorporate BMI and regional factors. BMI and regional variations should also be considered when assessing the risk and setting premiums. Invest in prevention. Investing in prevention programs such as smoking cessation and weight management could lead to long-term cost saving. And for individuals, quitting smoking is one of the most effective ways to reduce medical cost and improve overall health. Maintain a healthy weight. Maintaining a healthy weight can significantly reduce the risk of chronic diseases and associated medical expenses. So, thank you for watching my presentation on medical insurance data analysis. I hope this project provides valuable insights into managing healthcare costs effectively.